Just last month, women from all over the country were in the nation's capital talking with legislators about the need for more emphasis for funding for women's health issues, including dozens of health advocates from Georgia. They were talking about infertility, endometriosis, PCOS, cancer, and more. But right here in Augusta, we've got dedicated doctors and scientists who are constantly working to get funding for research into women's health concerns. And one of our most prominent doctors doing that is Dr. Ghaande, a gynecologic oncologist who is the executive vice chair of MCG's Department of Obstetrics and Gynecology. And Dr. Ghaande, thank you so much for your time today.
Thank you.
Appreciate you being here. You've done a lot to bring clinical trials for women with gynecologic cancers to our community.
So I came here in about 2000. One of the first things I noticed that although we could give good standard of care, we really could not do anything more than that in terms of getting opportunities for our patients to get cutting edge technology which would make a difference. Because historically the way cancer used to be, you either had cancer, we took care of you and you did well,
right,
or we couldn't do much and you passed away. That's not true for gynecological cancers. What we are doing currently is we are working really hard to make it a chronic disease. We may not be able to cure you, but as long as you can live with cancer and we have one treatment after the other to kind of keep you going,
yeah,
hopefully without too much of toxicity so that you have a good quality of life. And that's where clinical trials are really, really important, to almost build different treatment regimens one after the other so patients can live for a long time. And I think so, and it took me about 4 years since I came here to really start clinical trials. It takes a little while to get the infrastructure going.
right,
And we started small with some cooperative group trials, and now I'm really proud to say that we have a portfolio of stuff which we do in town for a woman with gynecological cancer, which is probably second to none in the southeastern United States. We do phase 1 trials, which are first in human, to cooperative group trials. We have been lucky enough to be chosen as one of the 12 sites in the United States for the minority NCORP designation from the National Cancer Institute, which allows not just for gynecological cancers, but for all other cancers to work with community sites like Athens, like Phoebe Putney in Albany, Georgia, or in DeKalb or Morehouse, to get clinical trials to the community so the patients don't necessarily have to drive all the way up, and allow women, especially of color, to have opportunity to participate in these trials. Because
there is a disparity there.
Oh, absolutely. There are huge disparities, especially in the state of Georgia. There are disparities across the board for a lot of cancers, whether it's with what stage they come in or what the outcomes are. For gynecological cancers, it's very, very true. And in fact, stepping back, if you look at clinical trials in general, that is the only vehicle that you can make progress with. If you don't do trials, there are no new discoveries and you are still caught up with your old status quo. So
yeah,
across the board in the United States, there are literally less than 5 to 7% of all patients who go on a clinical trial. So if you look at those patients, less than 5% on average are minority patients. So it's a question of access to those patients of color to be able to get the technology which is new and cutting edge. And secondly, the simple fact of the matter is all people are not necessarily the same. So when you have a clinical trial with 5% minorities and we get that drug to FDA as a new medication for all, the reality is the way a drug is metabolized in the body and the bioavailability, the active amount of drug which reaches, say, a tumor is different. It's different for a Caucasian woman, from an Asian woman, from a Hispanic woman, or a Southeast Asian, or an African American woman. Yeah. So sometimes there is no differences, but for certain drugs there are differences. So we just can't assume that those are all true, and that's why this is really cool that we can get patients of different races, especially minorities, more represented in clinical trials for both the opportunity as well as to really see if the same medication works across the board in a similar fashion.
Yeah, interesting.
So the minority NCORP grant that we have, we were just looking at our data, our accrual for the last 3 years is 47%. 47% of patients who we put on clinical trials are actually women of color, which I think is very, very cool.
That's very good. Right, absolutely. And I'm sure that you're excited about the Georgia Cancer Center and what a big deal that is for the Medical College and AU Health.
We are. I think the Georgia Cancer Center is, although it's an Augusta University institution, honestly, the way it's set up, it's a cancer center for the community, for the CSRA and the neighboring parts of South Georgia, because if you look at the landmark of cancer centers in the United States, Georgia is probably the only state with a big landmass and a big population which just has one NCI designated cancer center, which is in Atlanta, which is Emory.
Yeah.
So we are really striving to see if we can build up a research portfolio and a patient population focusing on certain things, and one of them are cancers of our gynecological cancers and disparity research, to be able to, over a period of time, have a robust cancer program to qualify for an NCI designation.
I hope that happens. And we thank you for what you do in our community.
Thank you very much.
Coming up next on Jennie, ovarian cancer patient and her doctor, and learn why she's involved in clinical trials right now at the Medical College of Georgia. We'll be right back. On that tease video, who are with me now, Christine Inslee, who was an ovarian cancer patient, and Dr. Keelan Patel, who's an OBGYN resident at MCG AU Health. And Dr. Patel recently presented findings from a clinical trial that he's in the process of conducting at the Society of Gynecologic Oncology's annual meeting on women's cancers. Thanks so much to both of you for being here.
We appreciate you having us.
I want to talk about your situation, and I want to talk about the importance of trials, and that's what you're doing in your residency.
Yes, so currently I'm a third-year resident, and my research interests lie in health disparities that are related to women with gynecologic malignancies. A lot of things have been identified, but not kind of researched further. So what I was fortunate enough to present at the SGO annual meeting this year was the research that we did here at Augusta University due to our special patient population. We looked at ladies that were diagnosed with ovarian cancer between 2004 and 2017. As mentioned by Dr. Ghaande, we have a very amazing minority NCORE grant, which lets us look at a specific population and helps us enroll minority patients into clinical trials and treat a large group of minority patients.
Okay.
There's well-established data that shows that there's health disparities in terms of race in ovarian cancer. When patients who are not on a clinical trial, Caucasians versus minorities, we found that there was a large difference in their overall survival when it came down to it. However, when patients were placed both on clinical trials, Caucasians and minorities, we found that that difference was completely eliminated, and that there was no difference in median overall survival, and we were able to give minorities and Caucasians the equal access to give them the same overall survival and benefits of the clinical trials.
That says a lot, doesn't it?
It really does.
Wow.
It's a very well-known thing nationally, but a lot of people don't understand that disparities have multiple facets to them, especially in healthcare. And identifying this has really helped us broaden and understand the racial disparity and will help us further overcome this disparity with clinical trials with access to care. And that's what we hope this is going to do moving forward.
And that disparity doesn't just have to be racial. It can be, access. In our area particularly, there's the whole rural issue. And there's so many outlying areas that don't have the access. I know telemedicine has tried to play a big part in helping with that.
Yeah. No, telemedicine plays a huge role. We have created an amazing culture here with all of our patients to help them understand clinical trials. And we've overcome this barrier of access to care, actually, which is really cool here in Augusta. Dr. Ghaande has set up kind of a nonprofit which has helped our population overcome that access to care with the Lydia House, which we have here. So while patients are here, they're able to travel from faraway distances, living greater than 50 miles, 25 miles, however far it is. They're able to come here, get their treatment, stay in a place which is like home. Exactly, right? With their family, they're able to go to their treatments, go home, and then able to actually go home after they're done with that. And that's something special that's done only here in Augusta.
It's a beautiful thing.
It is a very beautiful thing.
It really is.
So what was really, really neat about that is that a lot of people say that people in the rural areas don't have this access to care. So they're not necessarily receiving the standard of care therapies that are needed for their specific gynecologic malignancy. This kind of overcame that as well. So we eliminated that access to care facet in the health disparity, and we specifically were able to show that clinical trials really do help overcome that racial disparity.
And one of the patients in your trial is Christine, and we have a little video of you and Christine in the office there. How long have you been a part of the trial, Christine?
Since 2016.
Is that when you were diagnosed? Or? Okay. And tell me what it was like for you when you learned you had ovarian cancer.
Shocked, denial, scared,
Sure.
uncertain
Right.
of
Right.
the outcome.
Did you have to have surgery and chemo?
I had surgery. I had chemo, 18 treatments of chemo.
Oh, goodness. And what is your feeling about the trial, and what have you learned, and how have you benefited from being a part of it?
I was informed about the clinical trial the first day I was diagnosed with the ovarian cancer. And at that point, I was very pleased to go ahead and participate in it. I didn't have no second thoughts. I just said yes.
Yeah.
Because I knew that it was going to help minority women
Right.
to help survive women that usually don't get a chance. And I think we're all equal, so we should have the same chance all the way across the board.
And so the way that the findings are turning out right now, that's really positive. That if there is that access to treatment and everything, the chances are the same.
Yes, it is. It's the same. And that's good news.
And how is your prognosis now?
I'm in remission, which is good. And I just, feel a whole lot better as far as the clinical trials, participating, being able to help other women survive. Because the medications that I took as far as chemo, they were on clinical trials too once. So, and now I was able to take them and participate in the drugs that help, care for me. So now I get to help in the future for women.
Let me ask you this, Christine. Is there anything that you would say to women about, early detection and about the importance of their annual doctor visits?
It is very, very important for early diagnosis. A lot of research I've did on my own is a lot of women are found to have diagnosis in latent stage. Like I was stage 3. So, and sometimes it's misdiagnosed. So early detection, make sure you continue to talk to your doctor constantly. And if things are not right, just keep pushing to make sure things are done.
Well, we wish you all the best.
Thank you.
And thank you for being willing to come on the show today and to talk about a very personal issue. I know that you will help other people by sharing your story. Thank you very much.
You're welcome.
Dr. Patel, we thank you for your time as well.
I appreciate it.
And you can find more information about the subjects that we've covered today on our website. Just go to WJBF.com and click the Jennie link. We'll be right back.